Hello, everybody. Let's get started. Thank you, everybody, for joining. My name is Christian. Today, we are going to talk about the post-op bariatric diet. I have a bachelor's of science in clinical nutrition from University of California at Davis. You can contact me here at nutrition@mexicobariatriccenter.com. This is my number. This is my direct line. It's 916-758-2745. You can text me. You can call me anytime. If you do call me and I don't answer, I will most likely give you a call back in 5 minutes. And then here's our TikTok. There's some fun little videos. You can get some ideas for some meals on here too. It's a great resource overall. So if you do use TikTok, make sure to check us out at Mexico Bariatric Center. If you have any kind of medical questions, please refer to our surgeon liaison, Jen. This is her email right here, and then this is her phone number. So any kind of medications that you might be taking and you're curious if you can resume it, if you have any issues with the surgery, medical issues with the surgery, you can go ahead and ask her. Unfortunately, I can't help you. All I can do is just refer you to her. Since I'm not a medical doctor, I can answer any medical questions. In this webinar, we will be talking about the 4 phases of post-op, the clear liquids, thick liquids, soft solids, and solid food. And then in part 2, we're going to talk about the nutrition goals 1 month and beyond. And then in part 3, we'll be talking about vitamins and why are they so important after post-op. So the clear liquid phase starts the day you had your leak test. So usually it is a day after your surgery, and it will last 7 days following the leak test. During this phase, all you want to focus on is proper hydration, allowing your stomach and digestive tract to rest, and your intake goal should be 64 ounces of liquids, and that can be from water, broth, sugar-free jello, sugar-free popsicles, sports drinks with 0 calories, 0 sugar. So you can use pretty much any liquid and to reach the 64 ounces. And sometimes it's difficult to reach 64 ounces, but I want you to try to get at least a minimum of 48 ounces to prevent dehydration. It's very important. Hydration will help you heal faster too. So make sure you do your best to get to 64 ounces. Try and take very small sips and drink fluids throughout the day. Limit your intake to 1 teaspoon of liquid at a time at first. Wait 60 seconds between each sip of liquid and try to sip at least 4 ounces per hour. In the beginning, it might be a little bit difficult. The water may irritate your pouch. So try different temperatures for water. You can do room temperature, warm water, cold water. Some patients are very individual. So some people are okay with cold water. Some people are better with room temperature water or even warm water. And I don't want you to stress about this. Fluids will not harm your pouch. They cannot stretch it. They cannot harm it. If you can drink more than 64 ounces of water, go ahead. It's okay. And liquids pass through your system without restriction. So initially, you might not feel any restriction, but that's just because liquids pass through your system very easily. Yes, and protein water. You can use protein waters too for your clear liquid phase. But please hold all the questions towards the end. I will be able to answer all of them. I just want to get through this education first, and then we can talk about any questions that you might have. You can try some herbal teas, decaf. Make sure it's decaf because caffeine is a diuretic and it can lead to dehydration. You can do infused water. You can put apple, mint, berries, lemon. Just be careful of the seeds. Try not to swallow any seeds. Bone or vegetable broth, or any kind of broth with no solids is fine. You can do clear protein waters, sugar-free jello and sugar-free popsicles, any kind of flavorings, water flavorings with 0 calories, 0 sugar. And you can also have sports drinks with 0 calories, 0 sugar. Those will help a little bit with hydration because they contain some salt and some potassium, which are both very important for hydration. Please avoid acidic teas like black tea, lemon tea, or hibiscus. Avoid all caffeine. Caffeine is an irritant and a diuretic, which can lead to dehydration. Avoid citrus juices or any kind of juices that are acidic. And then avoid anything carbonated. This is very important. Avoid coffee, carbonation, and acidic teas or any kind of acidic liquids. Here are some options for the clear liquids. The bone broth right here, you have the Crystal Light with 0 calories. You can also have coconut water if you want. Skinny Girl is a brand that has a lot of health conscious dressings. Even like, for example, this is a mocktail. You can do the white cherry. Vitamin Zero, Powerade Zero. Protein 2O is a protein water. You can have this on the clear liquids. And I will stress this again, no carbonated beverages. This is important. The carbonation can actually stretch your stomach. It can cause bloating, discomfort. Usually carbonated drinks are also acidic, so try to avoid carbonated drinks. After the 7 days of clear liquids, you will be moving to the thick liquid phase. Here we have a new dietary goal. You want to try and aim for 60 to 80 grams of protein per day. Please choose a protein supplement with at least 20 grams of protein and no more than 5 grams of sugar. This will help you with your energy levels. It will give you some protein too if you choose the right protein supplement. And getting enough protein is the main goal of phase 2. Protein aids in proper wound healing after surgery. It helps your body burn fat instead of muscle. And we still have the same hydration goal, which is 64 ounces per day. And then at the end of the thick liquid phase, which should be 14 days post-op, you can begin your vitamin supplements. This is also an important rule right here. Avoid using a straw or gum. Both of them can introduce unwanted air and can lead to bloating. For the thick liquid phase, here are some options for you. You can do blended soups. I recommend homemade. If you make it at home, you can control the ingredients that go in it. And then I recommend a very simple bean or lentil soup. It can be as simple as canned beans, broth, carrots, onion, garlic, but make sure you blend it. You can also do some smoothies, but please avoid store-bought smoothies. Those ones are very high in sugar and they're not approved for the thick liquid phase. You can do a very simple smoothie with water or your choice of almond milk or coconut milk, protein powder, half a banana, some ice if you want to make it cold. And that's a very good smoothie. It has some good carbs, some protein. So yeah, if you want to choose smoothies, please avoid store-bought smoothies. You can have protein shakes and protein powders, plant milks like almond milk, coconut milk. You can do soy milk if you want. Oatmeal or cream of wheat is also okay during this phase, as long as you make it a little bit more thin at the beginning, and you can make it thicker as you continue to heal. Sugar-free pudding is also a good option. Plain high-protein yogurt, so like a Greek yogurt, that's a great option also. And we have two options here, like the Too Good and the Oikonos 000. These ones are good Greek yogurts. They have 0 sugar or 0 fat, and then they have a lot of protein. It's very easy to on the stomach. It helps because it is a probiotic too. It has a very good bacteria to help replenish your gut. And then natural applesauce is okay. Make sure it is a natural applesauce and it doesn't have any added sugar. Avoid everything with added sugar during this phase. Avoid high sugar flavored yogurts, ice creams or sorbets, smoothies from chain restaurants, store-bought baby food. Even if it has the right consistency, store-bought baby food has a lot of sugar in it and is not advised. And you're still going to avoid carbonated beverages. Here's some options, some recipes for the thick liquid phase. You can do the oatmeal oasis. It's just cooked oats, 1 scoop of protein powder, cinnamon, and this is optional, or 1 teaspoon of peanut butter, also optional. This is a very good breakfast, for example. You can also do the creamy vegetable soup. You can do carrots, garlic, onion, potato, some thyme, chicken or vegetable stock, and then use half and half or oat milk. Try not to use heavy cream. It has a lot of fat, and you can slow down your weight loss. And then this is the protein shake or smoothie that I was talking about earlier. You can actually add some vanilla Greek yogurt to it, unsweetened almond milk, protein powder, ice cubes. If you want to add half a banana, by all means. And then you can also add 1 teaspoon of regular peanut butter, or you can add 2 tablespoons of the PB Fit. PB Fit is just a dried peanut butter, and it has less fat and less sugar than the regular one. But these ones are very good options for the thick liquid phase. And if you want, I will be able to send the recording to anybody that wants this. If you want the recording of this webinar, you can email me and I'll send it to you whenever it's ready, most likely tomorrow. But yeah. Okay, now let's do a check your knowledge. I will start the poll here, and everybody, if you could try and answer it, that would be great. I'll give you a minute to answer the questions, and after that, I will go over them. Is hummus a good substitute in phase 2? I wouldn't recommend it. It has fat. You can use it in week 3. And it's a little bit grainy too, so yeah, you can use hummus. You can eat hummus in week 3. Another 30 seconds and I'll go over them. Okay, great job, everybody. Almond butter is okay. Avoid the crunchy one. Almond butter is okay. Avoid nuts like in its full form, or even if they're minced, avoid nuts completely until 8 weeks post-op. Okay, good job, everybody. So how many ounces of fluid should you aim for the clear liquids? The answer is 64 ounces. And if you're having a rough time with that, you can try to aim for 48 ounces, which is a minimum to prevent dehydration. Fluid will stretch your stomach. True or false? False. Fluids will pass through your digestive system unobstructed, and they will not stretch your stomach. Can you try coffee at this time? The answer is no. You want to avoid caffeine or coffee for 8 weeks until after the surgery. It is a acidic liquid and also a diuretic, and the acidity can cause acid reflux, and it can actually lead to dehydration. After the thick liquid phase, you will move to the puree or soft solid phase. It begins 14 days after your surgery. You should be ready to eat some soft food at this point. But now we will introduce this rule right here. Stop drinking 30 minutes prior to eating. Don't drink anything during your meal, and don't drink anything 30 minutes after your meal. This can loosen the bolus of your stomach and make it and cause rapid gastric emptying. So pretty much the food doesn't have time to properly digest in your stomach, and it will rush down into your intestines, and that can cause dumping syndrome also. So please don't drink water before your meal, during your meal, and after your meal. At this point, you will also want to introduce one new food item in each meal. The reason for this is you want to know exactly if you get nauseous from something or you don't tolerate something, you want to know exactly what caused it. Because if you add, let's say, some scrambled eggs with soft cooked vegetables and avocado, you will not know what exactly caused this intolerance. So try to add only one food per meal. Introduce soft foods. It must be soft enough to mash with the fork, and then try to consume protein with all meals. You want to aim for 2 to 3 ounces of protein, 1 tablespoon of fat, and 1 ounce of carbohydrate. Your whole meal should be at 4 ounces maximum. If you overeat, you can stretch your stomach. So please limit it to 4 ounces in week 3 pretty much. And eat slowly and chew your food properly, and introduce only one new food in each meal. Try to eat 3 meals a day and 1 protein shake a day. The protein intake recommendation is still 60 to 80 grams, and your daily calorie intake should be between 800 and 900. So yeah, and also weigh your food to 4 ounces. It's okay if you cannot have 4 ounces. Try to do 2 to 3 ounces. At least 2 ounces should be protein. If you can eat more, at least 3 ounces should be protein. Here are some options. You can have cottage cheese, avocado, canned tuna with mayo or Greek yogurt. You can have scallops or any kind of like soft seafood, poached or scrambled eggs, baked salmon, baked tilapia, baked cod, any kind of white flaky fish is fine. You can try some braised beans, braised meats. It's important that they're very well cooked until fall apart. Moisture of the food and the texture of the food matters. So if it's a dry piece of chicken, you will probably have issues with it. But if it's a braised chicken breast that is very moist and shredded, it's more likely that you will tolerate it. You can try some well-cooked vegetables. Again, you have to be able to mash it with the fork. And then, for example, soft tofu is very soft. It's very gentle on your stomach and your digestive system. So these are some items that you can try. Please avoid raw vegetables, white bread, steak or tough cuts of meat, popcorn, hot dogs, cookies, desserts, or any kind of processed products or snacks. Keep it simple. Listen to your body. If, let's say, you're trying some scrambled eggs, if you cannot tolerate the eggs, just give it a break, wait another day or two, and try them again. It is important that you try new foods to learn what you can tolerate so you can accurately reach your goals for the week. Here are some options. You can do an avocado chicken salad. You can just do 2.5 cups of chicken breast cooked, ripe avocado. You can do some red bell peppers, but make sure they're cooked. Lime juice, black pepper, and it should be a very good, healthy, creamy chicken salad. It should taste really good. I've had it before; it's pretty good. Or you can do like a low carb pork roast. Pork roast. You can add the spices, onion, garlic, celery, mushrooms, organic coconut oil or ghee, and then some water. But make sure you cook it until it's very tender. You can break it with the fork. And yeah, this is a very good protein-rich meal, for example. Or you have the option for a cottage cheese salad, 2 hard-boiled eggs, coarsely chopped. You can add some cottage cheese, mustard, salt, dill, lemon juice. And this one is very high in protein and very gentle on your stomach, and is very satisfying too. So yeah, these are a couple of options. After the soft solid, you will be moving to solid phase. This one begins typically 21 days or later following your surgery. At this point, you're pretty much in the end zone. You made it. It's time to create a healthy plan. You should try a variety of foods. You should be able to digest most soft solid items without discomfort. You can try any firm foods at this time. Try to continue to chew to applesauce consistency. And some foods, like I mentioned before, like the steak, the popcorn you should not have ever because it's very hard to digest. But some foods may take a little bit longer to be able to eat comfortably. Don't feel discouraged. Just give it time. Everybody heals at a different pace, and everybody can tolerate different kinds of things. At this point, you want to focus on protein. Always focus on protein. It helps with healing, and it also helps burn more fat. Your protein should be at least 3 ounces. You can do 1 to 2 tablespoons of fat. So, for example, some avocado or some olive oil, and then limit the carbohydrates to 2 ounces. I see all the questions coming in. I will answer them at the end of the webinar. These are some common food triggers in the first 3 to 4 months. Raw veggies, scrambled eggs, tough meat, chicken. I've noticed it matter the moistness of the food and the density matters a lot. For example, If you're having problems with chicken breast, try some chicken thighs. They have a little bit more fat, they're a little bit more moist. So if you can't handle chicken breast, you might be able to handle chicken thighs, for example. White rice and regular pasta are also very hard to tolerate. White bread or bread in general is very hard to tolerate. Carbonated drinks and nuts. Nuts and seeds, avoid them for the first 8 weeks. Um, After that, you can try them, but the nuts and the seeds are harder to digest. And they can get stuck in your staple line, leading to complications. This is just a scenario. I will go over it with you. So today is your first day of soft solids. You have not tried any soft solids yet. For your first meal, you decide to try cottage cheese and a poached egg topped with avocado. So you might think, what's wrong with this scenario? All of those items are approved. Why can I not have them? Well, for your first meal, you're introducing three things: cottage cheese, poached egg, and avocado. So you're having a couple of bites of this, and all of a sudden you feel nausea or you vomit. You don't know which one caused it. So that's why it's important that you introduce only one item at a time until you learn your body, your new digestive system. So just make sure you only try one thing at a time. This is scenario two. You're going through Facebook support group. You see that another patient had very good weight loss stats. You ask her what she's been doing, and she's saying that she's been lifting weights at 3 weeks post-op. Well, that's pretty premature. So you decide to ask Jen, Sarita, or me when you're clear to begin strength training, just to be safe. And they say 8 weeks. So yeah, this is kind of a trick scenario. The person that asked what the appropriate time to begin strength training is correct. Please don't try to do too much in the beginning. You have to wait until you're fully healed to begin strength training. So wait at least 8 weeks before you do any kind of strength training. Until then, just walking 15 to 30 minutes a day is more than enough, and it can actually help with healing and losing weight. So try not to rush through this. Wait until 8 weeks. Okay, now let's talk about some nutrition goals 1 month and beyond. So how much should you eat? Well, everybody tolerates a different amount after the surgery. The normal ranges are between 2 to 8 ounces after 1 year. It's normal to be able to eat more in volume as you heal and as time passes. But try to keep your meals to no more than 4 to 6 ounces in the first 6 months. Use a food scale and measuring cups. It's important that you measure your food. Don't force yourself to eat more than feels comfortable. If you feel full, stop. Don't try to finish the meal. Just listen to your body. Your stomach will not stretch from eating specific foods or eating too much at one time. It stretches if you do it often. So, like if every meal you're overeating, the chances of your stomach or pouch stretching is very high. So eat less and spread it out throughout the day. If you feel hungry, instead of doing 4 ounces, you can do 2 ounces, but you eat more frequently. Here are some healthy macronutrients you can do for oils and fats. You can do avocado, olives, a variety of nuts and seeds. You can do any kind of them. Nut butters are fine. Just make sure they're not chunky. So no bits of nuts in there. Olive oil is good. Avocado oil is good. Flaxseed oil is good. All of these are healthy fats. For protein, you can try some seafood, Greek yogurt, any kind of poultry, lean meats, cheese, egg, tofu. Perfect. These are perfect for lean meats. For carbohydrates, try to focus on complex carbohydrates. Sweet potato is a great complex carbohydrate. And whenever I say complex carbohydrate, usually that means they have a little bit more fiber. They keep you fuller longer. Your blood sugar doesn't spike as much as compared to like simple carbohydrates. For the sweet potatoes are better than regular potatoes. So if you want to try some kind of potato, try sweet potato. That's not saying necessarily that regular potatoes are bad. It's just sweet potatoes are a little bit better. Vegetables, fruits, beans and legumes, whole grains, oats. And here I want to bring attention to this Ezekiel bread. This bread is a complete protein. This is the only bread that I know that it's a complete protein. Usually breads are not complete proteins because they are missing one amino acid. So if you want to try a healthy bread, this is it right here, Ezekiel bread. You can find it at big chain stores. If they do have seeds on it, please avoid it until the 8 week mark. But yeah, this is a good way to make sandwiches. To be honest, I use it myself. It's a complete protein. It has like 9 grams of protein per slice, so it's a good bread. Here's a sample daily meal plan: 2 eggs, 2 ounces of vegetables, 1 tablespoon of fat. Protein shake as a snack for lunch: 3 ounces of protein, 2 ounces of vegetables, 1 tablespoon of fat. Snack: half a cup of berries and a cheese stick. Dinner: more of the same as lunch: 3 ounces of protein, 2 ounces of vegetables, beans, fruit, or whole grains, whatever you want, and then 2 tablespoons of fat. At 1 month and beyond, this should be your intake goal: calories between 1,000 and 1,200, protein between 75 grams and 105 grams, carbohydrates less than 100, fats between 30 and 45, less than 25 grams of sugar, and more than 20 grams of fiber. Here are some helpful tips. This is how you should prioritize your eating. Prioritize fluids, protein, healthy carbs in that order. Fluids will help you keep hydrated. Protein will help you lose weight and heal faster. And then healthy carbs are going to keep you full and just provide the extra nutrients that you need. Be patient with your body. Incorporate exercise at 8 weeks post-op. You can do your own research if you like, but if you can't find the answer to a question, you can always ask me. Keep a positive mindset and healthy relationship with food. It's very important that you don't develop a unhealthy obsession of making sure you eat the perfect thing at all time. Please don't. Food is meant to be enjoyable. Try not to overreact. If, let's say, you have a cookie when you're fully healed, it's okay to have one. And then also, this is going to keep you healthy by not developing eating disorders. Do not chew food and spit it out. That is the beginning of a what is it called? Eating disorder. Sorry. So yeah, don't chew food and spit out. I know you want to chew it, especially during the early times of recovery, but please don't do it. Keep up a vitamin regimen and make sure you get your blood work done every 3 months to prevent any deficiencies. And then realize that the health is not all about the scale. You can take measurements of your body. You can look to see if you lost some sizes in your pants, for example, or t-shirts, and then just look for overall energy and health improvements. This is just a table on how fast you can return to work. For example, if you have a sitting job and you had the gastric sleeve, 1 to 2 weeks. For example, if you have a fast-paced job and you had the DS, it's recommended to stay home for 2 to 4 weeks, and so on. So just make sure you think about it in advance. Try not to go to work too soon. It can lead to complications. And this whole table is on our website too. All you have to do is just search on the blog, how fast can I return to work, and then you should be able to find it. Part 3, we're almost there. So, vitamins. Vitamins are very important, especially make sure that you get bariatric vitamins. It's important that you start them 14 days after the surgery. If you start them before, it's not necessarily bad, but bariatric vitamins are very concentrated and they might cause nausea or even vomiting, and that can really put you off of the vitamins, and that can lead to dehydration too and other things. So why are they important? Well, they will help you with fatigue, muscle loss, blurred vision, nerve damage, hair loss, general weakness, cracked and dry skin. It will overall improve your health, and it can help with weak and brittle bones. This is the ASMBS guidelines. Before I go through it, I want to make sure everybody understands this acronym BMVI. BMVI just means bariatric multivitamin. So whatever you see from BMVI, this amount can be in the bariatric multivitamins. For example, thiamine. Most bariatric multivitamins will have thiamine. It just has to have at least 12 milligrams. So yeah, take a bariatric multivitamin daily. Your thiamine should be around 12 milligrams. If you are vomiting consistently, you need to increase that to at least 50 to 100 milligrams. Zinc can also be contained in the bariatric multivitamins, and make sure it has at least 15 milligrams. Calcium citrate with vitamin D. For VSG or RNY patients, make sure you get between 1200 to 1500 milligrams. For BPD-DS, make sure you get 1800 to 2400 milligrams. Vitamin D can be contained in the calcium citrate and also the bariatric multivitamin. And try to aim for 3000 international units. Iron with vitamin C. This can be contained in the multivitamin. For males with no history of anemia, 18 milligrams. For menstruating females, 45 to 60 milligrams. And then vitamin B12, 500 to 1,000 micrograms sublingual pill. It's important that it is some sublingual pill because the way vitamin B12 is absorbed after the surgery is through your mouth. So you just put the pill under your tongue and you just let it dissolve. Or you can do a 1 cc injection or a nasal spray. For the 1 cc injection, you would have to go through your primary care physician. They're prescribed and you'll have to have them do it for you. Another reason bariatric vitamins are important is because they prevent hair loss, and I know that's a very common concern for after the surgery. This may happen during the first couple of months. It's due to rapid weight loss, lack of calories or protein, and then a bad quality vitamins, and misunderstanding the vitamin schedule. We have our own brand. It's called Emerge Bariatrics, and this is the website right here. This is a bariatric specific brand. Compared to the generic vitamins, it has 4 times as much vitamins. They're easy for your body to absorb. They use sugar alcohols. And then the generic chewable or gummies are too high in sugar. Some of them have even like 3 grams per serving, which would add up if you have to take a lot of them. For sleeve patients, it's recommended that you take them for at least 6 to 12 months. And for any kind of malabsorptive procedure like the bypass or the DS, it's recommended to take for life, because with those two surgeries, you don't absorb the vitamins very well, so you have to take them. And we have, I like to call it the perfect bundle. It's called the ultimate kit, I guess. It comes with 2 bottles, a complete multivitamin with iron, and this is a chewable, and then a calcium citrate with vitamin D soft chew. This will meet all your requirements in just these 2 bottles. So if you don't want to think about it, go ahead and just get this. Take the multivitamin once a day with food. It's important that you take it with food because, like I said, they're very concentrated and they may cause nausea, but if you take it with food, it's not going to happen. And even if it does happen, then you can actually just split the multivitamin in 2, take half in the morning and half at night. Make sure to take the calcium 3 times a day. Your body can only absorb 50 milligrams of calcium per dose. So don't take all 3 of them at once. Take them spread out throughout the day. We also have the multivitamin infusion. You can mix it with water. This is a little bit more tolerable, but it's also a little bit more expensive. You would do 2 scoops a day. It has calcium citrate, fiber, electrolyte blend, and vitamins in liquid form bypass the digestive process and are absorbed directly into your bloodstream, so you get more of it. You absorb more of it, and the liquid formula should not upset your stomach. We also have a meal replacement. It has 27 grams of complete protein, for 50 milligrams of calcium, zinc, biotin, and it has less than 5 grams of sugar. And I've heard nothing but good things about this. A lot of people like it. They say it tastes like a smoothie. I will try it at some point. For every post-op webinar, I say that I'm going to try it. I haven't tried it yet. Here's a multivitamin comparison. For example, this is just a table that compares the bariatric multivitamins with generic vitamins. Thiamine is one of the important things that you need to look for. The bariatric multivitamins will have 12 milligrams of thiamine compared to the Centrum Adult multivitamin that has only 1.5 milligrams. Folic acid is more, like almost twice. Biotin is more. Vitamin D is more. Zinc is more. So you can see that if you do choose to go with the generic vitamins, you'd have to take a lot of them to reach your guidelines. Thiamine, you have to take like what, 10 Centrum Adult multivitamins a day. So yeah, it's important that you do have bariatric multivitamins. I get this question a lot, if Flintstone vitamins are good. No, they don't have any thiamine. Folic acid is low. Zinc is not sufficient. They have 3 grams per 2 gummies. So yeah, try to go with bariatric multivitamins. You can get chewables, soft chews. And then when you're a month in, you can actually just get the capsules, because at that time you should be able to tolerate them better. What about patches? A lot of patients ask about patches. While patches are okay, a study showed that people that use patches have actually 82% higher chance of at least one deficiency, compared to the 40% in the pill group. And then as you can see, the vitamin D deficiency was seen in 81% of the patients, the patch group, compared to 36 in the pill group. So patches are not adequate. You can supplement them if you want, but you'd be wasting some money on them. Yeah, I don't recommend them. I also recommend this is a recommendation, is not a requirement, but I do recommend digestive enzymes and probiotics. They will improve your digestion overall. After the surgery, you don't have the same digestive enzymes. And then supplementing can assist with preventing nausea and as well increase absorption of nutrients. They help break down the food and digest the food. And then the one that I recommend is an over-the-counter papaya enzyme. The brand doesn't really matter as long as it's papaya digestive enzyme. I also recommend probiotics. If you look for one with at least 50 billion CFU or higher. It helps create a healthy balance of bacteria. It aids in digestion, boosts the immune system. You can actually lose a lot more weight with probiotics compared to not using probiotics. They can increase the absorption of B12. And for this one, I do have 2 brands that I recommend. One of them is Align, and the other one is Garden of Life. I forgot to mention this. It's important that you do not take calcium and iron together. They compete for absorption, and you have to wait 2 hours in between them. So yeah, let's do this real quick. The poll, I apologize for not mentioning that earlier, but the answer to the first question is calcium and iron. What symptoms are we looking for to tell if we aren't tolerating a new food? Nausea, vomiting, bloating, diarrhea, all the fun stuff. Do we need to take Band-Aids when we go for the surgery? No, you don't have to take Band-Aids with you. What are the foods to avoid long-term? Popcorn is one of them. And then depending on how you heal, carbonated drinks can upset your stomach. That's pretty much the 2 main ones. Is high protein pasta okay? Yes, but 4 weeks post-op. How long before our surgery should we stop drinking alcohol? At least 2 weeks before the surgery, but ideally you want to stop completely like 6 months before. In the thick liquid stage, can I mix whipped cream cheese with yogurt? It's low in carbs and sugar. Depends on the cream cheese. I don't recommend it. It's gonna be a little bit too rich, and you might have some discomfort. Do you have an opinion on non-wheat pastas like banza made with chickpeas? They're fine as long as you eat them at your appropriate stage. But they're totally okay. I had surgery 214. Do I wait 2 weeks to start taking omeprazole with my supplement? No, you can take omeprazole as soon as you get out of the hospital. It helps calm down your stomach. Can carbonated drinks after we heal stretch our stomach? It's possible, but not likely. If you drink carbonated drinks and eat, then it might happen. What about milk? Premier protein in week 2? Yes, you can have it. You can have. I recommend 2% milk in week 2 or skim milk, but you can have protein shakes in week 2, and Premier Protein is a great one. How long should we avoid alcohol post-op? The answer is 6 months. 6 months post-op. Avoid alcohol. And then whenever you do hit the 6-month cutoff, please take it slow. You will get drunk or tipsy faster than you used to, because by then you'd be losing weight, and then also your whole digestive system is new, and alcohol can be absorbed better actually after. So just avoid. Try to take it slow, have a little bit at a time, and see how you feel. But I do not recommend alcohol. When can we introduce sourdough bread? You can introduce any bread 4 weeks post-op. Okay, let's just finish with the webinar, and then I can answer more questions. So which 2 vitamins can you not take together? I apologize, I didn't mention this, but it's calcium and iron. Avoid taking calcium and iron together. Why are probiotics recommended? They can improve digestion. They create a healthy balance of bacteria in your gut. They can help you lose weight. And they're just very good in general. Will over-the-counter vitamins be sufficient? The answer is no. They're nowhere near sufficient for after the surgery. This is a podcast done by our past patients. It's called Can You Stomach This? You can get their perspective and experience of having surgery at MBC. Some episodes are the post-op diet, exercising after weight loss, surgery, weight loss stalls. This is a very good resource that you can use. It's done by Sarita and Rena. They're 2 of our past patients. You can find it on YouTube, our website, Spotify, Google, Apple, anywhere you can find your podcast. It's most likely there. And we also have the Mexico Bariatric Center blog. This is a great resource that you can use. The YouTube channel is also great. The support group, if you want to talk to your peers, and you can we have a recipe support group too. The MBC Instagram and the MBC TikTok. These are great resources if you want to check them out. You're welcome, everybody. Thank you so much. Have a great day. Bye.